Welcome to the She Found Motherhood podcast. It's Dr. Alicia here, and I have the pleasure with chatting with Nita from at Happy Healthy Eaters today about all things starting solids in your infant baby. Nita is a registered dietitian who lives in Winnipeg, and she and Jess Penner started at Happy Healthy Eaters to help parents understand in a real life circumstance how to start solids and support their infant and toddlers through those first few years of their relationships with foods. Super excited to get into this really important conversation right after this quick reminder.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Nita, thank you so much for joining us today on the She Found Motherhood podcast. We are going to be talking about starting solids in your little ones. And this is something that we get asked about all the time as family doctors. When should we start solids? What foods do we start with? How do we start? Do we puree things? Do we do baby-led weaning? All of those types of questions. And we have a little bit of training in this. We've done it in our own kids. We should be talking about this with the experts. So you are here as a registered dietitian and co-founder of Happy Healthy Eaters, and you're going to chat with us a little bit about starting solids. So why don't we get going?
For sure. I'm so excited to be here. Thank you.
Tell us a little bit about yourself.
I am a Punjabi mom. I was born and raised in Winnipeg, small town right dead smack in the middle of Canada. And my love for nutrition actually started really quite early. I was about 16 or 17. And it's helpful to know my parents had a grocery store in the core area of Winnipeg. And I would see what a lot of our customers were purchasing and then learning a lot of chronic disease prevention. And I thought, wow, like if someone could just, educate people a little bit more about food choices, could this potentially influence other health outcomes? And then realizing really like health is just, at 16, like my interpretation of health was really limited, but now I've kind of expanded that. And so decided right out of high school to take a course in university, never intended on doing anything in pediatric care. And upon becoming a dietitian, I've actually always worked and currently do work in geriatric care as well. So it's wonderful to be a part of that stage for folks. I'm caring for them at the end of their life. And then when I had my own children, I was really inspired to learn a little bit more about the complexity of feeding infants and toddlers. It's a really interesting stage in life.
It sure is. And those first few years even get harder and harder than just the infant stage.
Yeah.
Then it gets a bit easier.
Yeah.
Awesome. And then you and Jess have started a business, Happy Healthy Eaters, and you're on the Instagram.
We are.
Awesome. Cool. And we'll let everybody know at the end and put it in our show notes how to reach out to you and where to find you. So why don't we get started? So what are the common issues that you get asked about as a dietitian in terms of starting solids in kids?
Yeah, I think, there's definitely like several, and we've polled our community and we've asked them like, what are your top like feeding fears or questions that you have? And so we actually came up with a document that we created for our community, and folks can download that right from our website. But I'd say like the number one sort of fear for people is lack of education, is like, when is the most appropriate time to start your baby on solids? And I think this is for a few reasons, because there's this wide open range. You could start anywhere from 4 to 6 months, but you and I know that developmentally, like a 4-month-old baby could be very different from another 6-month-old baby. And so it's really important. And Jessica and I strongly encourage parents, instead of comparing and going just by an age, look for those developmental signs of readiness for your baby.
And so what are the signs of readiness that you suggest to look for?
Yeah, definitely like having a baby that has good head and neck control. And that's really important because you want your baby to be able to kind of nod their head or be able to say no. And that's a great way for them to communicate. No, mom, like I'm all done with feeding right now. So we need that adequate head and neck support. Most babies are doing this at 4 or 5 months too. They're starting to put objects in their mouth, their hands and their feet and start that mouthing process. So that's another really wonderful sign that your baby might be headed in that direction. This one's a little bit more complex, but you also want to look for a reduced extrusion or tongue thrust reflex, which is like your baby's sort of natural intuition or reflex to just stick their tongue out when that area is stimulated. We want our baby, when we're spoon feeding them or giving them food, we don't want them to push it out of their mouth. We actually want them to push it back so they can swallow. So that's a really important one. And we find that does tend to diminish somewhere between the 6 and 7 month mark. General interest in watching parents eat food is really important and absolutely adorable too. I've seen videos of babies trying to, steal a parent's smoothie or banana, and then having your baby sit with some minimal support, but sitting independently a little bit. I know for me, my kids didn't do that until 7 or 8 months, but if I just had my hand at their lower back, they were fine at about 6 months.
Yeah. So we usually say the supported sitting. So if they're in
Mm-hmm.
their high chair, then they can sit
Yep.
up. They're a little bit wobbly still, but they've got that good
Yeah.
head and neck control and they've got some stability there. Exactly. That's
Yeah.
great. So do
Yeah.
you have any tips on testing your child's extrusion reflex?
Yeah, you can actually, it's very simple. You can take a spoon. It doesn't even have to be an infant spoon, but you don't have to put anything on it, but just put it at the tip of your baby's lips and see what happens. If they're sticking their tongue out and trying to push that spoon away, chances are that reflex hasn't quite diminished yet. So you might want to wait a week. So that's what happened with me. I thought, we're ready to go here. And then I started to notice that his extrusion reflex was still quite strong. And I thought, I'm just going to put this on the back burner for another week. And sure enough, it was gone by then.
Awesome. So another thing
Mhm.
we often get asked is, how do you start? Like, how do you actually, once you've determined that your child is ready through those signs of readiness we just chatted about, like,
Yeah.
how do you
Yeah.
start? What do you start feeding them? What kinds of foods? Do you have to wait in between foods? Does it have to be puree? Let's chat a little bit about that.
Yeah, we go into this a bit more detail in our Start Solids Confidently course. But when you're thinking about starting your baby on solid, it's helpful to tune in to your own baby. And that's a really great way that parents can practice being responsive in their feeding technique. So right now in the sort of feeding world, there's a few different ways that you can approach feeding. A lot of parents are quite familiar with traditional or puree feeding. And even in my academia, when I was in university, that's all we focused on was you give your baby mashed up food. And we are totally supportive of parents starting with purees. And in fact, I use purees for both of my kids as well. And then understanding that there's this other concept of feeding your baby, and it's called baby-led weaning. And the term can be really confusing. It hails from the United Kingdom. And in the UK, they use the word weaning to identify essentially when your baby starts solids, they've started this lengthy journey of weaning, whether it's off the breast or off the bottle. So in baby-led weaning, the idea is that your baby actually skips purees and is self-feeding right from the start. It's important to note, though, that it's contraindicated to do this before 6 months. If you're the parent that wants to start at 5 months, then it's probably a better idea to do a puree or kind of a lumpy texture. But if it's 6 months and you think your baby is showing signs of wanting to be independent and bringing food to their mouth, then go for baby-led weaning if it is attractive to you and if you want to lean into that. And then you can also do a combined approach, which we really find in our practice parents thrive on because it's a great opportunity for parents to feel really relaxed as their baby's ingesting food by offering purees, but then your baby still gets to do that exploring and grabbing food and all that fun stuff you see babies doing on social media. You get to experience both of those.
I remember with my first child, as one does with their first child, I Googled the bejeebers out of how to start solids. And there was these two camps of feeding purees and feeding
Yeah.
and doing baby-led weaning. And I got down this rabbit hole of baby-led weaning, and I would be on these sites and people would be asking questions. What if I just do a few purees? And then the people who were on these sites were berating them for not doing it
know,
exclusively.
no.
And I was just,
Yeah.
But you know what? Everybody's different. And we say this around choosing how to feed your infant, like before they start solids. Everybody's
Mm-hmm.
different. Every family's different. So you have to look into the options and choose what's right for you. So I'm assuming in your
Yeah.
course, you're going to go over a little bit about the science behind it and the different options and how to go into that, hey, in a little bit more
Yeah,
detail.
100%. And it's maybe worth mentioning, like, there's no evidence to suggest that you can't mix the two approaches. And to me, that's normal eating culturally. I grew up with Punjabi food, naturally mushy textures and, lentils and dal, and it's all pureed and just like yogurt. But then there's lots of handheld options. So I think that the mixed approach is really beautiful. It's also critical that children learned how to tolerate a puree food because it helps with lip closures. We don't often think of these little things, but it's important.
Awesome. So moral of that story is do what's right for you and your family and don't worry about what other people think.
Like, that intuition is so important. And I think as experts, like, we're just here to offer you that education. You're going to know what is the best way to start for you and for your baby. It's really petrifying and sad for some folks to start with baby-led weaning because that anxiety of the gagging and the choking. So if the feeding dynamic is not positive and fun and relaxed, that's not good for anybody that's involved. We really want that feeding relationship to be relaxed.
That's awesome. So you broached on it a little bit, but what do we start with? So what kind of food do we start with?
Yeah, we really want those first few food exposures to be complementary, iron-rich food. It's really cute to see baby with a banana and a sweet potato and avocado, and a lot of parents' natural inclination is to lean into these foods because maybe they're soft and they feel safe. From a nutritional standpoint, your baby has a variety of nutrient needs, but at 7 months, their needs for iron skyrocket. To help put it into perspective, my 16-pound son at 6 months, needed more iron than my 6'2", 200-something pound husband. And so that kind of blew my mind, but also really emphasized how important iron is for them.
Yeah. So what kind of foods do you recommend? And given that we all live in a different kind of cultural milieu, maybe a few options to try to start with.
Yeah, if you're an omnivorous family and you're consuming animal products, you might want to lean into things like bison, ground beef, fish, dark chicken. Chicken breast actually doesn't have very much iron in it. So these are all really great sources of iron. And if you also have access to wild game, like, that's a great way to expose your baby to those foods as well. And if you are a family that's leaning more towards plant-based nutrition and eating, then leaning into legumes, lentils, beans, even things like blackstrap molasses has a bit of iron in it, and infant cereal. I think a lot of people, because of Google's ability to create a lot of fear mongering, are wanting to maybe stray away from infant cereal, but we actually love infant cereal in our practice, and we use it a lot for our recipes as well because it's a great source of iron, and it's essentially grains that have been fortified by iron. And these foods are routinely checked by the Canadian Food Inspection Agency, so they are safe for baby.
Yeah. And then you can use that as a base to add other things in. Like, it's a great base. Or if I know some of our kids, once they start on solids, they're not really great at taking in fluids. Or if the breastfeeding parent is leaving and the baby is not good at taking a bottle, the non-breastfeeding parent or the caregiver can often add in some breast milk or formula into that iron-rich food to help get them hydrated as well. Now, there's the whole thing about not absorbing iron with calcium and dairy, so you have to be a little bit cautious. But those are some ways of, increasing the fluid intake as well if the non-breastfeeding parent is away and the baby really doesn't take a bottle very well. Also, a sippy cup is great. Just one of those sippy cups at the table with all meals is really important, and that kind of gets that hand-to-mouth dexterity going as well a little bit. Awesome. Hey, Sarah.
Yes, Alicia?
Do you ever find that people bring in their birth plans to show you in the office and they're not even hitting the important points?
I do. And I think that they don't even consider all the options when really we often don't have any idea of what to expect going into labor.
Agree. So what we did is we put together a free birth plan download, but we also put together a little course about how you can fill it out, talking about what the real purpose of a birth plan should be and how it can really help you have the best birth you can.
We've got an area that covers your medical history and your pregnancy, and then we've got a section that helps you walk through and figure out when you might accept certain interventions. Not just yes or no, but at what point and at what stage in your labor and birth experience.
We go over some examples through case studies to help you get an idea of what this could look like. And we also think it's really important to use your birth plan as a jumping off point for conversations with your partner and your provider. And we talk a little bit about how you can start doing this with our birth plan course.
Absolutely. If you're interested in learning more, head to our website, www.shefoundhealth.com/courses.
See you there.
Can we talk a little bit about allergens? Because I know this has shifted from when I started about 10 years ago. I'm feeling super old till now. This has actually shifted quite a bit in the recommendations around starting allergens. So why don't we just do a general discussion for people who don't have huge allergenic issues in their family about how you guide parents around that?
Yeah. I got an opportunity to learn a lot about this because I had my son in 2017, and the 2017, that year was when that landmark study was published, and a lot of the recommendations were changing around allergy introduction. It was all done by the LEAP study. So if you are a nerdy, sciencey person, you might want to Google the LEAP study. But essentially what came out of that was we do not need to delay the introduction of highly allergenic foods anymore. That sort of used to be the general recommendation, but now if you have a baby that is low to moderate risk for developing an allergy, you can actually start to offer things like peanuts or almond butter, sesame seeds, wheat right at 6 months. And it doesn't mean you need to get it all done back to back in that first month, but definitely 6 to 10 months, you might want to knock them all. And in Canada, we have a priority list of 11 allergens. Other countries, they've got their own priorities, and it may not be as lengthy of a list. But what's unique about Canada is we include mustard and sesame. And a lot of other countries, they don't include that as a top priority allergen.
Yeah, there's a kid in my youngest class who's allergic to sesame and fish. And eggs and grass.
Oh, that's tough.
And
and
nuts.
So much compassion for those parents too.
And the rest of us who have to not have anything in our kids' lunch. It's so hard. I feel bad for their family because I don't know how they do it. I mean, you just figure it out. But yeah, there's good evidence. The earlier that you introduce things, the less likely the children are actually going to be allergenic later on. And that has shifted. And I think, which is amazing. And the other thing that I think is just really important for people to note is putting food products on babies' skin prior to them actually having ingested it will increase their risk of having allergies to it, because our skin is a barrier to bad things happening. And so if bad things, our body perceives it as bad going onto our skin prior to us ingesting it, then we can actually create an allergy to it. The exception to that is coconut oil, which is usually pretty safe because it's very low allergenicity. So I usually, if somebody wants something natural for a moisturizer for their baby, I'll say coconut oil. I'm a big fan of Vaseline, but I know a lot of people don't like that. But so don't put things on your baby's skin prior to them having ingested it.
Yeah, 100%. Your baby really needs to be ingesting this, this food, and it shouldn't be through the skin. And we need the immune system to kick in if necessary.
Yeah, excellent. And then I have another question for you. So again, when I was doing my training, I learned from my preceptors, not from dietitians, because why would we ever have dietitians come talk to us in medical school about their area of expertise, which is partly why we're doing all of these podcasts, because we learn so much from our colleagues. If somebody is starting solids around 6 months of age, what are the guidelines around how often to introduce something new? Has that, because it used to be wait 3 days and then introduce something new. And then I think recently it's if you started prior to 6 months, wait a few days before starting something new, but at 6 months, just go for it. What do you guide people with?
When we were developing a course, we wanted to sift through some of that evidence to see why do we recommend this? And I realized there's actually no good reason why we need to, wait 2 to 3 days for every single food, because if we do that, and I think some parents do this with the best of intention, but then month 7 or month 8, they're like, no, like we need to pick up the pace here, because it could then take maybe a really long time to get to those family friendly meals and to join the family at the dinner table. That being said, I think if you are a parent that has a child with multiple allergies or is presenting with FPIEs, like you've almost got no choice but to go slow and steady. But if things are going really well for you, I don't see why you can't offer your baby something simple like a marinara with pasta. The marinara will have onion in it and maybe zucchini and some oregano. But to have to test each of those individually, like that could, that's almost a 3-week process.
Well,
So,
and what baby's going to eat an onion?
yeah, exactly. Yeah.
No, baby.
Yeah. Yeah. And I mean, I have to ask myself, like, how did our ancestors get all the way here? It probably wasn't by testing like one food item at a time. We just gave what was available to us. And so I think leaning into that is really important. But I want to mention that for parents that are struggling with the allergies, or maybe you're a parent with postpartum depression or anxiety, it might be your saving grace to take things slow, and as you gain more confidence to start picking up the pace. But you don't have to wait 2 to 3 days in between things like apple and broccoli and ricotta. Like you don't need to be doing that.
Yeah. And I think if you are worried or concerned, reach out to your friendly registered dietitians, because they're full of knowledge and ideas and can really help support you through that. So it sounds like
Yeah.
this course of yours is great, and it's taking kind of the guidelines and the science and chunking it up into like realistic tips and tricks for parents,
Yeah.
hey?
Yeah.
And you
Yeah.
guys have generously given all of our listeners 15% off your course. So the code is SFH15, I think. So we'll
Yep.
link that in the show notes, and we will link it on our website. And so if you're interested in taking the course, make sure that you go through our link, because it'll help us. And then you'll get that 15% off. You just put it in the coupon code.
Wonderful. Yeah.
Awesome. So I know we have touched on it a little bit about, I'm a huge proponent of, I say family dinners, but family meals. And I know that you're a big proponent of that feeding relationship and that interaction between parents or caregivers and infants, and how to really make sure that you're doing that in a positive way. Can you talk a little bit about that?
Yeah, for sure. And I'm so glad we're touching on this, because I think as dietitians, but then also as parents, we get stuck in like the microcosm of nutrition. And that's what it is. It's a microcosm. But when you're actually feeding your baby, there's so much more that's happening. It's a huge developmental milestone. And we've done the math between the ages of 6 months and 20 years. You're going to be making 20,000 meals for your child. And we don't want to be struggling through all 20,000 of those meals. We want them to be joyous and memorable experiences. And a really great way to foster that is as a family. And families are really unique today, trying to identify, where can we sit down together and have a meal, whether it's at the dinner table, around the coffee table, a picnic. But I think that sense of togetherness is really important. It's not only a great opportunity to model the idea of eating to your child, but it's a great way to help them with speech development. We've got tons of research to support that children who have family meals have lower risk of risky behavior into adolescence. And I know, though, and I can speak for myself, parents are busy. We're all working and doing our best. But even 1 to 2 to 3 meals together as a family is wonderful. And it can be any time of the day, breakfast, lunch, dinner, but just that sense of being together is really, really important. And we know this because we've done the research now.
Yeah. And I think it's really important to make those screen-free times. So this is just talking with each other and focusing on each other. No phones at the table, no screens at the table, if you're going to do this concentrated family meal time. Other times you have to do that type of stuff, but certainly for those kind of family togetherness times, making sure that it doesn't have to be, it could be half an hour. It doesn't have to be a long time, but it's just focused, concentrated time together as a family, which is great. I have one last question for you. Screens while eating. Tell me your thoughts on that.
It's a slippery slope for sure. And I find, around that 18-month mark, you've got your baby who's now a toddler and they're starting to not maybe eat as much. And part of that is biological. They don't need as much food and they're starting to develop preferences. So I think parents, as out of the best of intentions, they use it as a distraction technique to get more food into your baby. But it's really important to pause and ask yourself, what are you doing? And really, that form of distraction is ultimately pressure. We're pressuring our kids to eat, even though they're not hungry anymore, or they don't want anything to do with that particular meal. And in today's day and age, we're talking a lot about mindfulness and intuitive eating. And eating in front of a screen, it really, really makes it difficult for everyone, to be attuned to your hunger and fullness cues. I would say to parents, whatever you can to prevent heading down that road. And if you're already in it, then just gently weaning off of the screen can be really helpful. There are very rare cases with children with more severe sensory processing disorders where maybe the screen can be actually helpful, but that case is fairly far and few between. And usually an OT or an SLP might be there to help assist you through a plan that suits your family. But yeah, the screen time at the dinner table is a slippery slope. Yeah.
And for all of us, you're right. Even for us adults watching TV while eating, we're not paying attention to what we're eating. We're not enjoying the food. We're not listening to our bodies. It's just mindless eating. And that's not good for our society and for our bodies. So.
Yeah. I'm even thinking back to when we used to go to the movie theater. My husband and I would just buy a chocolate bar, a pop, and then get the value. So we get the really big popcorn. And no, I'm not going to finish all of it. It's fine. We're not going to finish all of it. We'll take it home. There was never an opportunity to take it home because you do finish it all because the movie is so entertaining. You're totally distracted. And so, yeah, it happens to all of us at all life stages. So it's still important to kind of practice mindfulness.
Awesome. We covered a lot today. So we went over common questions parents have in terms of starting solids, when to start, signs of readiness in your baby, types of foods to consider, and making sure you're getting those iron-rich foods in. We've also chatted about having a really good relationship with your child around eating and creating positivity and that focused family time when you're able to. And then just a reminder to people, you've got that amazing free download. So that's the 5 feeding fears. So common questions people have. And you talk about choking in that, allergens, et cetera, et cetera. And then you've got your amazing course, which kind of takes those guidelines and that science and chunks it down into kind of manageable steps for parents. So that is, you can find that at we'll put a link in our show notes and we'll put a link on our website as well. And then we've got that discount code. So that's SFH15 for that 15% off of that course, which is incredible. And then where can people find you guys if they want to get a little bit more info?
Yeah, you know what? Not everywhere. We just entered the wild, wild west world of TikTok at Happy Healthy Eaters. We're on Instagram at Happy Healthy Eaters, and you can add us to your Pinterest board as well. And then if you want to reach out to us via email because you've got maybe a complex question you want to ask, you can contact us at hello@happyhealthyeaters.com.
Awesome. Thank you so much. It was an absolute pleasure to chat today, Nita.
Yeah, thank you. Thank you so much for having us.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.